The top element in our model represents blood pH. Hopefully, as you all know, a normal range for blood pH is 7.35 to 7.45, with the pH being described as acidic if it goes below 7.35 and alkalotic as it goes above 7.45. The middle element in our model represents CO2, the respiratory component of blood pH. The normal range for CO2 is approximately 4.5 to 6 kilopascals on an arterial blood gas. Slightly confusingly in this model, we have inversed the scale. So we have high CO2 levels over here on the left and low CO2 levels down here on the right. Hopefully the reasons for doing this will become obvious as the video progresses. When CO2 combines with water, we get carbonic acid. Therefore, high levels of CO2 in our blood are going to drive our pH in an acidotic direction, and low levels of CO2 are going to drive our blood in an alkalotic direction. We clear carbon dioxide from our body through our lungs on expiration. The more effort we put into breathing out, the more CO2 we will clear from our body. For example, a patient suffering from chest pain may begin to panic. They could in fact begin to have a panic attack, which will cause them to hyperventilate. Hyperventilation will cause them to blow off more CO2. A low CO2 will drive their pH in an alkalotic direction. This would be referred to as a respiratory alkalosis. We might give this same patient morphine to help with their chest pain, but if we overdo it, if we give them too much, then we could potentially suppress the respiratory centres in their brain with the opiate. As a result, they will start to hypoventilate. CO2 will build up in their blood and their pH will be pushed in an acidotic direction. The bottom element of our model represents the metabolic component of acidosis. We measure the metabolic effects on blood pH by measuring the bicarbonate levels in our ABG. Bicarbonate is primarily produced by the kidneys and acts as a buffer for pH in the blood. It effectively mops up excess protons, excess acid, and converts it into carbonic acid. Carbonic acid can then be broken down into water, which the body can use, and CO2, which can pass out through the lungs. Normally, enough bicarbonate is produced by the body to buffer any acids produced by metabolic processes occurring within the body. Metabolic changes in pH occur when there is an imbalance between the amount of acid being produced by the body and the available bicarb to mop up that acid. For example, a type 1 diabetic who doesn't take their insulin will start to produce ketones. Ketones are acidic. Acid will build up in the blood at a faster rate than the kidneys can produce bicarb to buffer its effect. The pH will be pushed downwards in an acidotic direction and the bicarb will be used up. Blood bicarb levels will begin to decrease. Reduced bicarb levels therefore indicate a metabolic acidosis. A metabolic alkalosis can occur when there is too much bicarbonate in the blood compared to the amount of protons, the amount of acid being produced by the body. The acid will be buffered at a faster rate than it is being produced, and our pH will be pushed in an alkalotic direction. This would be referred to as a metabolic alkalosis. Of course, respiratory and metabolic components of blood pH don't work in isolation. They simultaneously affect blood pH. In some circumstances, both components may push blood pH in the same direction. For example, a patient suffering from severe acute sepsis will eventually start to suffer from multi-organ failure. As tissues become hypoxic, anaerobic respiration will occur and lactic acid will be produced. This will push the metabolic element in an acidotic direction. The lungs will eventually also become damaged and their ability to clear carbon dioxide will be reduced. CO2 will begin to accumulate in the blood, pushing the body into a respiratory acidosis. We would call this a mixed acidosis, as both respiratory and metabolic components are pushing in an acidotic direction. I hope you found this video useful. If you have any questions, please feel free to leave them in the comments section below and I'll do my best to get back to you. Otherwise, thanks for watching.